Hi everyone, this is Dr. Garner here. I want to talk about the second letter in the NAP meditation, because if you've seen any of the other videos I have on NAP meditation or resetting the nervous system or some of my breathing videos, they all have a common thread. One is that they are yoga-based, using something called medical therapeutic yoga. So it's where I'm combining physical therapy and other rehab sciences with yoga to make it more effective than just yoga by itself. That second letter in NAP is A. So what does that stand for? It stands for apposition. It's a fancy word for the shape of the respiratory diaphragm, your breathing diaphragm. Now, if you look at my diaphragmatic release video, which is on YouTube, just type that in, I talk about how to, and the scientific literature supports, releasing the diaphragm in a way that improves lung power. That's an easy way to say it, is lung power. We're talking about improving the capacity of the lungs, which is really important in the age of COVID, but also during allergy season, if you have asthma, if you have pelvic floor problems, if you have breathing issues, if you have voice problems. For example, apposition is so important to the diaphragm here that the equivalent would be, what if you tried to, how well could you sing with your head thrown back? I can't even really talk, much less hum. So if I sit here and I say, just humming, what happens when you do it with your head back? It cuts off the sound. It actually hurts. It doesn't feel good. I have to push the air harder past the vocal folds to make any sound. It's not very sustainable. Likewise, if I held my head down here and kind of occluded and tightened my vocal folds, or if you saw me breathing like this, right? And I was chest breathing and these muscles here were really tight, then it might sound something like this. I can't really get a really good clear voice. Same thing happens with your posture of your diaphragm. That's what apposition means. We want it to be in a place just like your vocal folds. Can't be too tight, can't be too extreme in this direction, extreme in this direction, or extreme compression here. Not good for the voice. And most people depend on their voice, right? Okay, same thing here for the posture of your diaphragm. If your rib cage is too flared, I want you to try and take a deep breath by hyperextending, kind of arching your back a bit and flaring your ribs. Try to take a deep breath like that. You can't get it in. You can't get enough breath in, and you're definitely not breathing down into the deep lobes of the lungs back here. Same thing, try to take a deep breath here. Really can't do it. So I want you to find a comfortable position. This is all part of resetting the nervous system, where I'm just going to do a little pelvic clock and roll my pelvis around. I call this swimming. So swim your pelvis around until the air drops in more fluidly and evenly into the lungs. And you get more of a rib cage expansion out to the side. Okay, not just a belly expansion, but what we call lateral costal expansion. The rib cage should bucket handle lift out to the side. No chest breathing, no tightness here. So I'm going to take a deep breath. Nothing happens here. No chest heaving, no tightness. So I want you to continue with this swimming. Okay, swimming around to try and get out of a slouch. If you have a crease right here in your abdominal, in the skin of your abdominal region, I know you've been kind of collapsing all day long, or you've been stuck in a weird position. So no front flaring. If anything, I want you to think about back rib flaring. Imagine someone picking you up from your back ribs and then just letting the low back feel long and decompressed. Now let the air drop in and keep moving. You're not stuck here. Keep moving until the airway feels more open and clear, until the root of the tongue, so feel the back of your tongue, move it around in your mouth, until the root of the tongue is released. Now, if you're not getting ribcage expansion out to the side with a deep breath, that's okay. I want you to go and look up my diaphragmatic release, my diaphragm release video, and do that. That is where I can get up under the ribcage, touch the back of the ribcage. I inhale, my ribcage expands, but it doesn't flare. It doesn't flare up. It expands this way. That's important. It expands, and then exhale. I can really massage the respiratory diaphragm. Doesn't hurt, feels good. Rib cage can expand to be nice and mobile. That's what allows you to have a better pelvic floor, a stronger pelvic floor when you need it, a better voice for singing and for speaking and teaching. As a PT, I teach all day, I educate all day, but as a singer, I also need to preserve that voice. So this A, the letter A for apposition of the diaphragm, is one of the most important things you can do to reset your nervous system to manage stress better. So I hope this little tutorial has helped you. Stay tuned for the P in nap. I'll tell you what that means in the next segment.